Hello, everyone. I'm Dr. Vasiliou. I'm a principal investigator of the ASpida against-stigma pain intervention development approach. And as you know, this is a project that is a collaboration between University College of Cork in School of Applied Psychology and the Chronic Pain Island and the University of Uppsala in Sweden. And we got this grant from the third edition of the BMP, the Patient Innovation Center. So what is ASpida? ASpida is actually, we aim to develop one-time group-based intervention for individuals with a chronic pain experiencing stigma. And we are following the trainer approach, where individuals will implement the program to the local communities and then train others so that we can keep a sustainability of the programs across the years. This is almost now 3 years collaboration with Chronic Pain Island, and actually we started running an online survey so that we can understand all the parameters involved in the experience of stigma, and then we use these sort of like findings from our survey to co-develop several prototypes, let's say several exercises that we tested with a group of people, so that we can finally inform the half-day workshop, the half-day intervention workshop content that we're going to run soon. Unfortunately, as you know, and as you have all experienced, COVID also hit on us, and we had to turn all the research part of this project into digital. But we've been working almost for 1.5 years with a fantastic group of people. We set up a public PPI, public patient involvement group, where individuals from members of the Chronic Pain Island were trained in research and help us to co-develop several of the exercises that we later tested with another cohort of individuals with chronic pain. So we've been working for many months to co-develop several of the exercises that that help us to develop the half-day workshop. So we develop mock-ups, all the digital sort of like prototypes, animations, films, and recording exercises and experiential exercises. And what we did in the research, actually, we asked a cohort of individuals with chronic pain from the community to cope how they experience stigma. We prompt them to elicit the previous stigma experience through experiential exercises, and then we sent them a platform where we had uploaded all these digital sort of like components, and we asked them to apply those kind of exercises for 2 weeks. Then we asked them, we invited them to come to us and share their views, how they have found these exercises, how useful or acceptable these exercises would be for individuals with chronic pain participating in a half-day workshop. Ultimately, all this piece of knowledge help us to co-develop the ASpida protocol and the Cotman. So we run a mapping exercise, as we call it in research, where we identified and synthesize all the available knowledge, and now we are sort of like attempting to implement the local the project to the local communities. So the project is going to be implemented from individuals with chronic pain experiencing stigma in the local communities. And the goal for us is to actually have this as a year event through collaborations with Chronic Pain Islands, so that every year there should be an event, an anti-stigma protection event from Chronic Pain Island. We have followed the open, active, and aware approach, which basically means that we help individuals to become more open and aware of any kind of stigmatized experiences coming from spouses, family members, medical professional, their working environments, and of course social services. And we help actually individuals to become more active in terms of understanding and becoming more mindful about these stigmatized experiences, and pursuing following what matters most to them rather than what other things or believe for them. So basically, we use approaches in our intervention from the latest of the behavioral science to help individuals recognize stigmatized experiences and basically stop blaming themselves and internalize, of course, what others think or believe for them. And then we use approaches to empower people to pursue what matters to them, regardless of the stigma, instead of narrowly focusing on what others say or do. The next step, we are very excited because we are launching the very final implementation part of our project, which is actually, we're going to train a group of people across Ireland, and and this group of people will actually implement the project to the local communities. We'll collect some extra data so that we can ensure what parts of the program needs to be improved, and also ensure the efficacy of the program. So I'm very excited for the new project. Good luck to all the new projects. And again, a big thank for the supporters, the BMP grant, and of course, the constant collaborators, the Chronic Pain Ireland. Thank you and goodbye for now.